From Medline, they're going to talk to everybody today about briefs. They're doing a brief-in service.
So I'm sure most of you, my name's Helen, like she said, I'm a nurse with Medline. So I specialize actually in incontinence and skincare products. So we'll just go over a few application techniques. Maybe you'll learn something that you didn't know before. And I'm sure you guys have been using these products for a while, right? So they're familiar to you. Any new hires? No? Okay.
In the last 6 months, quite a few of them are new.
Okay, so you know you have multiple sizes of our products, right? And there's measuring tapes of how you measure your new residents, or if someone loses weight or gains weight, or if they're having any leaking, where in the brief that they've been in for a little bit, you can always resize them. This is 85% correct, but we really believe that sizing is important to help with leaking. That's why we're not a one-size-fits-most brief company. We have 6 different sizes available for you, okay? Because everybody's shaped different, right? Y'all don't wear the same size pants. So these are the measuring tapes. Everything's color-coded to make it easy. You just measure right over their clothes, sitting, standing, or laying, hip bone to hip bone. Wherever your finger lies, that's the color brief that you choose. Pretty easy, right? And then due to anatomy, different body style, you might have to go up or down a size depending. Otherwise, this is usually very accurate. Any questions with that? So you've seen our brief style. We actually model it after a baby diaper. So see that big leg opening? I'm sure you've all seen a pamper before. So the traditional size brief had extra material that sometimes, I don't know if you've ever used those before, but you would have to upsize the brief to make it fit in the thighs, and then what would happen? It would leak, right? So that is why we modeled our diapers after the baby diaper, that I shape. So I'm actually going to put on the blue brief, which is a large. So when you open it, side to side, this way. And then we have leak guards, just like a baby brief. So see how these, due to the packaging, this is tacked down. So to activate those leak guards, you want to just give it a tug on both sides so those stand up. Otherwise, if you just place it on the resident, you'll have leaking because those leak guards aren't doing their job. So this is a new technique. It won't work for every resident, but it's great for your residents that tend to squeeze their thighs together, are heavier, or are contracted. So I say give it a tug. After pericare, you have clean gloves on. You're going to fold it along the wetness indicator lines and then make it into a boat or a taco, like I said. So I'm going to pretend I'm laying in bed. You're going to roll me over to my side. Front to back for infection control. This is good for your contracted patients because sometimes you can only get in between the ankles, right? And then you can shimmy this up where it needs to be. I'm still laying on my side. So now you can see if it needs to go more forward or back. This can be better than the log roll technique that we use a lot because sometimes you roll them back over and then it's not aligned with the spine, right? And then you have to maneuver it. You're doing a lot of tugging. That's a lot of backache. So you have clean gloves. I'm going to just turn real quick. And you're going to pop this open. So see how that wetness indicator line's aligned with my spine? And then you're going to tuck this side panel on my side. Turn me over. Still have clean gloves. And you're going to pop this side open. And now you're ready to attach. So our side panels are supposed to attach right on the side here, just like a pamper, so all that leg is exposed. Because more open air into skin, drier skin is better skin, right? So these are breathable. Our tabs are skin friendly, so if they do get on the skin, it won't irritate them. And they're retachable as well to make it easier to check on the brief. So for containment purposes, I always say go down with the top tab. And up with the bottom. See how this just got real tight there? Because we're used to just going side by side, right? We're used to just applying them like this. And this works well, but for containment, see how this is more snug? So if you have somebody that is fecal incontinent, this will work well for them. And then you can always adjust it once you put them in a chair as well. So down and up. So this looks like it fits well, right? Fits pretty good? Just by looking at it? Okay, well I'm actually, when I measured myself, this is a large, then there's a regular size, and then there's the medium. I actually size as a medium. So this brief is 2 sizes technically too big for me. Because do you see where this bunching is here? If I was sitting in my chair, it probably would catch, but what would happen if I just moved my leg? It's gonna leak out the side, right? I like to show this because I'm a visual learner, and it does look like it fits, but we wanna prevent leaking, right? And that's why we have so many sizes. So that's why it's very important to size your residents and make sure they're in the proper fit to prevent leaking and skin damage. If that rubs up against my thighs, I could develop some skin damage there. So I'm just gonna throw on the white one just so you can see the difference. Do you guys use a lot of pull-ups too?
Mm-hmm.
Okay, just throw this on. Also, something you guys might not have known is the core of every brief has the same absorbency. It doesn't matter the size. It's the side panels that are bigger. So just because the brief is larger does not mean it's gonna contain any more. It's actually gonna possibly have that resident leak because it's not right up against the peri area. I'm gonna do the same thing with these. And I'm gonna go down with the top one and up with the bottom one. See how this one is much more up against my peri area here, fits more like underwear, right? And then see how it's tight along my back? So that will help with fecal containment too, when you do that crisscross technique. Okay. You guys have any questions? That makes sense, right? See the difference with the fit?
Can you, when you put it that way, because the last time we had the brief in service, they did the brief the other way, you know, the inside out. Because what happens in the groin, when you put it in that way, how is that protecting the groin? You know what I mean? Right in the crease here?
In the crease here?
Yeah, the side panel.
That's when you snap it?
Yeah, the way, the leak guards?
Right.
Like when you fold it?
Yes, so when you
Right.
open it up, you have to give it that tug.
Okay.
And this colored part or the white part, this will never tear on you.
Okay.
So I always recommend if you're going to be, you know, tugging, always tug on this. Has anybody ever had a side panel tear?
Oh,
Yes, okay. So,
Then you gotta start all over.
I know, so frustrating. So here's a little tip with that, because they're not, the side panels, they're gonna tear. I'm not just gonna say they're not. Because they're tacked on like this, all breathable side panels that are created are tacked on that way. So if you tug downward, because it's tacked on, it'll tear right off. I barely even touched it. But because this part is really strong and won't tear on you, if you have to grasp that side panel out from underneath the resident, try and grasp a little bit of the colored when you're tugging on the side panel. Kind of dog ear tie it when you're tugging on it, just to help. Otherwise, you might have it tear on you.
Or are you saying like sideways, like basically it was like, it's not?
No, because the last one we had where, yeah, you had to snap it, they showed it just the opposite.
Turn it
So
like
that
inside
was, you know, on the side here, you know where the guards are, yes.
Okay.
So that wasn't like in this way, You know what I'm saying?
Okay.
They had showed us doing it the other way, in between the legs. Like inside out.
Like inside out.
Because then the brief won't
This is-
turn and
yeah.
then.
Why don't you show me that? I would be
They
afraid
showed
of.
us, this is the way they showed, they had, two guys, and they did it this way. So that this
Makes
part
sense.
When you
was
pull it up,
here,
it went
because like when you put it on this way,
Okay. That's a new technique.
you know what I'm
I would
saying?
tr- I
Yes,
mean, you
and
can try
because this
both.
here, how do you know that that's not gonna?
Yeah.
Stay in.
Because they're
Yeah.
activated, like I just kind of pulled this up.
Right.
As you can see,
It's
See
already
how-
out.
it's fitting me. These are supposed to be out, like these are supposed to.
Right, but that's what I'm
Yeah.
talking about,
Yeah.
they didn't show us that way, they
Oh,
showed us
okay.
the other way, just to avoid that. That's why I asked.
Yeah, I mean, there's, obviously we learn different things every day, that's a new technique that I learned, so if that works, then continue doing that, whatever promotes good skin and prevention of leaking, whatever works best for you guys. That
So-
technique that I showed you won't work best for everybody, especially you have some residents that can stand and after you shower them and toilet them, you can just apply it while they're standing, that makes
Right.
life a little more easier. That technique is really for your contracted patients, heavier set, where you really can't pull it up in between their legs.
So
There's so many skills, right?
are we to assume that the worst, if someone's leaking, it's probably because the brief is not on correctly or it's too small or too big?
Yes, exactly. So application, big thing, maybe it's not aligned with the spine. We know some of our residents, as I just tugged, how loose that got. Sometimes they go in their pants and undo them. So it's not really the product, it would be application, maybe the resident took it off, or that it's too big. Because if it's dangling in between their legs, just like a pad, we want it right up against the peri area, because we want that fluid to hit the core to start absorbing, so it's not sitting on the skin or pooling. And then if I just move my leg, it would go out. Does that make sense?
Yes.
Helpful tips, learn something new from you,
No,
that's
I
great.
just-
Yeah, that's a new one. That's good.
I was just wondering, like you
Yeah.
said, just when something
Yeah, I
is
fold
so
it that
tight.
way.
You don't pull it, how's it gonna?
The only thing I worry about with that is you have to be just careful with infection control.
Right.
So that's why I always fold it in. So whatever works best, but still abiding by those
And like you said, it
techniques.
depends on the resident.
Yes. Sometimes that might
Yeah.
work if you can pop it outward by not touching the inside of the
Right.
core. And maybe if they're standing, that would work best for that
Sandy
that
St.
patient.
Pierre, please call 71.
Any other questions? Okay. You guys saw that the way the polymer works inside, I'm sure you've seen that before, that it's filled with a super absorbent polymer, just like a baby brief, so it gets heavy, right? Have you seen this in action? Okay. All right, any other questions?
You guys have any questions? Everything good?
Yeah, thank you.
All right.
There's two sign-ins for you, make sure you sign both of them, please. Thank you.